Hi, I'm Jamie Grossman. I'm a hip preservation and sports medicine physician at OrthoVirginia. I'm at the McLean-Tyson's offices as well as the Fairfax office. Today we'll be talking about femoroacetabular impingement, also known as FAI. So mostly we'll be talking about what it is and how it's treated. The hip is a ball and socket joint, and it moves in a congruent fashion. But sometimes when you have a little extra bone, sometimes on the ball or the socket, it becomes incongruent and it can impinge or limit your range of motion. So people sometimes notice that loss of range of motion, or sometimes they'll have different types of pain. Most commonly it presents as like a groin pain. Sometimes it presents as a side pain, and then very rarely, but it can present in the backside. Typically, patients will have pain when they cross their legs over, but sometimes it's just for sitting for long periods of time, or if they're standing and bending forward, or certain motions like lunging forward or deep extension with their leg behind them, it can still bother them also. We're not totally sure what causes this. Sometimes it's congenital, meaning you're born with certain ways that the ball sits in the socket, and so you're at a higher risk of it hitting one another. And when I say it hits, there's two different types, or there's three really, but one is you can have extra bone on the socket, which is called the pincer lesion, noted in the slide here on the left. And sometimes you have extra bone on the ball itself, which is also called a cam lesion. And then most people though present with the combined lesions of the pincer and the cam where they hit each other. So if you imagine you have this ball in the socket here, as you come up, it hits. And so I typically describe the labrum is this rubber ring that sits around the socket. That's usually what causes the discomfort for people, is when you get a labral tear. But the labrum is almost like if you have a Yeti cup or a Stanley cup. I kind of describe it as if that rubber ring that sits on the lid. It's weirdly similar consistency, but it provides a similar function where it increases the surface area and then provides a suction seal. So when the labrum gets torn, a lot of people have symptoms from that. So if you imagine my fingernails or your fingernails, if you did a ball in a socket like this, as you came up, it would hit the fingernails, and that would be the first point that it would break. And that's typically what causes inflammation and pain in the joint. So this is what an X-ray and an MRI would look like for someone who has FAI. And here along the femur, you can see this cam lesion. It's at the top of the head-neck junction. And then they also have that pincer lesion with that extra long or overcovered socket. On the right side is an MRI, which shows the ball in the socket, similar picture to the X-ray. So you're looking directly at yourself as we would scroll in and out, or front to back. On this top part is the labrum, is that triangle up top. And there's this white area next to it, which is fluid. White is fluid. And the only way that the white gets in between the labrum and the socket is if there's a tear there. Many people have labral tears. There were a couple studies done on athletes specifically, but over 90% of NFL players that had hip x-rays for other reasons had FAI, but not everyone's symptomatic. They did a study showing that over 60% of the La Liga soccer players in Spain had FAI, but not all of those players were symptomatic from it. Just like we think most of the population has FAI, but they're not necessarily symptomatic from it. So just because you may see or notice that you have a cam lesion or a labral tear, you don't have some of those symptoms we were discussing earlier, it's asymptomatic and I wouldn't necessarily do anything about it. It's controversial, and in theory, it may predispose you to having arthritis, but there hasn't really been a study that shows that having the labral tear or cam lesion will lead to arthritic symptoms. But if you do present with the labral pain or FAI pain, we would start with conservative treatment. That would start with activity modification and maybe a diet change. So sometimes low inflammatory diets can help bring down your inflammation and your pain, like a paleo diet or a Mediterranean diet, or we would try to limit some of the activities that would really be irritating your symptoms. And if we can minimize that, then you continue on your way. The next step would be some sort of oral medication. So anti-inflammatories like Advil, Motrin can help bring down the inflammation in the joint. And then in conjunction with that, we would do some physical therapy. And physical therapy would really focus on core strengthening, your hip abductors and external rotators, meaning your smaller glute muscles, which are really your pelvis stabilizers, and then your posterior chain. So some of these pictures here are your posterior chain versus your core exercises and some of those abductors and rotators. Most people who present with labral pain or particularly pain in the front of their hip aren't firing their posterior chain correctly, and then they have weak abductors or weak smaller glutes. So we focus on clenching your glutes first, then your hamstrings, then your back, when many people present with their hamstrings and their back clenching before their glutes. So we want to switch that around. The other thing is, the more we stabilize your pelvis muscles, the less micromotion I think you get in the hip joint itself. And so the less shear stress or pain you kind of get on the labrum. And many people do get better with conservative treatment. Now, if that doesn't work, the next invasive option would be an injection. Part of an injection would be diagnostic. So many people that present with hip pain also have some sort of mixed back symptoms. It's not always super straightforward that their hip pain or the pain that they have is coming from inside the hip joint. So the diagnostic aspect of the injection helps us narrow down if this pain is coming from inside the hip joint. And then if you did end up having surgery, what percentage of your pain would be relieved with surgery? Other parts of the injections could be a steroid, which is a really strong anti-inflammatory. The goal is to just calm the joint down so that hopefully you can continue to move forward and live on with the labral tear as long as it doesn't bother you. Another option are biologic injections. It's just a different form of an anti-inflammatory using your own cells to bring down the inflammation inside the joint and hopefully minimize your pain. And if conservative treatments do not work, the next option would be a surgical treatment. Now there's minimally invasive and then there's more open procedures that we can do. A hip arthroscopy is a minimally invasive procedure where we make 2 small incisions along the front of your thigh, and we go in with a camera and then some tools to visualize inside the joint itself, and then to repair the labrum if that's what's necessary, as well as to shave down some of that extra bone in FAI. So on the picture on the left, the top part of that triangle where the red is a labrum, and that's where the labrum is torn. And then to the right is the femoral head or the ball, and below that is the socket. So we can clearly see where there's irritation and where the labrum is torn. So on the right picture, that's after I repaired the labrum. So there's some sutures in there. We basically loop or put a suture through the labrum and kind of pull it back up so it's not sagging down into the joint like it is in the picture on the left. During the procedure, we make sure that you regain that suction seal and that there's no more impingement, meaning we take you through a dynamic exam and we make sure there's no more bone after we've shaved it down that's impinging on the labrum could cause another tear. And I continue to do that until there's no more impingement in your hip. The next slide is a little bit more graphic. It shows a picture of an open procedure. So if your stomach isn't made for it, I'd either cover your eyes or wait a few minutes. So this is a picture of an open procedure where this patient had some other issues, but it gives you as well as a labral tear. But sometimes with people with impingement with a lot of overcoverage, it's easier or it is a little bit better of a surgery to open to take that extra bone down. And so in the center of the picture is the labrum, and that blue stitch is one of the stitches that's holding the labrum or tacking it back down so it's not sagging into the joint. Now, just because you have hip pain or groin pain doesn't necessarily mean that the labrum is your problem, and every person is different. So if you think you're having any issues with your hip or your labrum, please feel free to come in. I'd be happy to see you and talk to you and treat you as your own person. If you have any questions, now is the time for us to discuss them.
Thank you so much. We will be answering questions submitted earlier and questions that are submitted live. So if you are watching live, please go ahead and submit your questions. Where do you feel pain from FAI?
So most commonly, people feel pain in the front of their hip or their groin. Sometimes people feel it on the outside of their hip. And then very rarely, but some people can feel it on the backside, so like their butt area. But almost where that crease is in the front is where most people feel the pain.
Thank you. How is FAI diagnosed? Do you need to have an MRI?
You don't need an MRI. FAI is diagnosed with an X-ray. That there's certain measurements that we take that from the X-ray that allow it to be within that criteria. And then based off of your physical exam, I can usually tell if you have a labral tear, or at least that you're symptomatic from the labral tear. So you don't necessarily need the MRI, but it helps us differentiate if maybe there's some cartilage loss or other pathology within the joint that might be causing pain other than the labral tear.
Thank you. Is FAI formed at birth or is it developed over time?
It can be both. So there are some people who are predisposed to having FAI based off of the shape or the anatomy of their ball in the socket or their head-neck junction, so more of the ball femur or thigh bone. But most people develop it over time. We think that a majority of people get it during their adolescence or during their teen years, and it's usually from microtrauma that occurs from being athletic. I wouldn't say not to participate in sports, but that's probably what is from deep flexion. And so like hockey players and soccer players and football players are at a higher risk.
Thank you. How do you differentiate between FAI and hip pain from arthritis?
So that can be very hard to do. And since I'm a hip preservation surgeon and I also treat arthritis, I see the gamut of patients who are unsure as to whether they have more FAI or arthritis. The pain can present similarly just as loss of range of motion. That's where further imaging comes into play. Sometimes the X-ray will show us. And in one of the pictures where the ball is in the socket, that's where the joint space is. And if you have good joint space, that's where the cartilage lives. And so we can assume, until proven otherwise by our MRI, that you have good cartilage and joint space. Now, arthritis is a totally separate topic, but it is the loss of cartilage and then a bony reaction to that loss of cartilage is what arthritis is. So as long as you have preserved cartilage within the joint, then I would consider you more to have FAI versus arthritis. But once you start to have global loss of cartilage, then you'd be more in the arthritis range, and hip preservation treatment or surgery might not be the best for you.
Thank you. You mentioned some sports that can be associated with FAI. So are there sports that are recommended that people do, or sports or activities that are not recommended? For example, running or cycling or swimming or team sports?
Sure. So for FAI and for arthritis, I'm not a believer in telling someone not to do what they enjoy doing. Okay. I think it's not fair to tell someone that when we don't know whether their FAI will get worse, meaning the bony changes, the labral tear won't significantly worsen or change their symptoms, but we don't know whether the arthritis will get worse. So it's not fair to tell you not to do something even if you sat on the couch and didn't do any activity, it still probably would get worse in terms of arthritis. Now for FAI, it's similar concept, meaning that like if you enjoy or if you have activities that you enjoy doing, but you can no longer do them because of the pain and we tried all conservative treatment, then the surgery is an option for you. And part of the reason to do the surgery for FAI or arthritis is because you can't do the activities that you want to. So it's an elective procedure to get you back to the activities that you want to do in terms of like a lifestyle change. And that would be a reason to have surgery. So I'm not a fan or a believer in telling you not to do sports or activities because you may be at risk in getting FAI or arthritis, when at the end of the day, if you can't do those activities, then you would be an option, or you could elect to have surgery to allow you to get back into those.
Thank you. What is the recovery time for the surgery?
Sure. So for the hip arthroscopy, it's generally, everyone's a little bit different depending on what you have done, but I'll just say in general, it's about 2 weeks on crutches with your foot flat on the ground, but not putting all your weight on your foot. And then it's about 6 weeks until you're walking more normally. And I'd say a majority of people find that they feel better than they did before surgery. It takes about 3 months until you can start to run and have more increased activity. And then return to sport on average is about 6 or 7 months. So it's not quite like the knee scope that maybe your friends had that get back to doing all the things they want to do in 2 to 6 weeks. This is, although it is a minimally invasive procedure, it is still a very big procedure.
Thank you. Can the FAI pain be disguised as some type of muscle strain instead? Do people think that they just pulled a muscle, but it's really FAI?
So it can be disguised as that. And there actually have been some studies that show that patients with FAI are at higher risk of certain muscle strains. So sometimes if you get the FAI fixed, your repetitive muscle strains, or sometimes just the muscle strain itself, will improve.
Thank you. Is having lopsided pain, so a pain only on one side of your body, one of the symptoms of FAI, or do you usually have it on both sides of your body?
So it can be on both sides. It depends on the person, but just because you have a labral tear on one side doesn't mean you have to have one on the other side. And then the other question that's up is the pain in the glutes on one side, a symptom of FAI, and that can be a symptom of FAI. And it could also be a symptom of other problems along the hip joint itself.
Thank you. Do genetics play any role in getting FAI?
The short answer is yes. We don't really understand, or we don't have an answer as to what the genetics are that actually play a role, but yes, I think it does.
Thank you. Is a total hip replacement treatment for FAI?
I would not offer a patient a total hip replacement for the treatment of FAI alone. FAI, and what I'm referring to as FAI, is someone who still has good cartilage. And so that's why the hip preservation procedures they would benefit from. But a hip replacement is for someone who has loss of cartilage, and then that's an option for them. But there are some people who started with FAI and have cam and pincer impingement, but now they have cartilage loss, and then hip replacement becomes an alternative for them.
Thank you. At what age does one usually have a problem with FAI? So are people usually getting surgery when they're 25, when they're 40, when they're 55?
All of the above. I'd say it starts usually in young teenagers. Patients can get it. And then I see people up in the 60s to 70s who have FAI without any cartilage loss. But once you start getting a little bit older, more people tend to have some cartilage loss. So the hip preservation surgeries for FAI become a little bit less available to them. And sometimes it's a waiting game for arthritis. But it can be any range starting from about 12 or young teens to 50s, 60s.
Thank you. Can FAI happen in conjunction with hip dysplasia?
Yes, you can have both. So hip dysplasia, once again, another totally separate topic, but is when someone has less socket over the ball. So I describe hip dysplasia as if you have, instead of having a cereal bowl, you have more of a dinner plate or your socket. And so sometimes people can still impinge. Usually the problem with hip dysplasia is that lack of socket. Your labrum is trying to act as your weight-bearing surface on the socket, which is why they tend to tear their labrums. But you can also get cam lesions that are impinging on the labrum too. So you can have both with hip dysplasia.
Thank you. Is one type of impingement more common than other types? And does it change by gender or by age?
Sure. So cam lesions tend to be more common in males, and pincer lesions tend to be more common in females. It doesn't necessarily change by age, except that you have increased risk of presenting as you increase in age. But overall, that's the general types that go with the certain genders. But many people have mixed. It's not usually just one for most people.
Thank you. If someone has surgery for FAI when they're young, like if they're under 40, will they need surgery for FAI again, or will they need other types of hip surgery?
So there's always that risk that even if you have your labrum repaired and the bone shaved down that no longer impinges, sometimes people grow that bone back. And other people who don't even grow the bone back, they do sometimes re-tear their labrum. So there's always that chance that you can have another surgery, but the goal is to have surgery once and not have it again.
Thank you very much. Does having children increase the chances or reduce the risks of FAI?
I think that hormonal changes can affect your symptoms. I have seen women who present with labral tears probably after birth or during birth, as it can be a traumatic experience. But I think it has more to do with hormonal sensitivity that people are a little bit more lax in their soft tissue, and so they can be more symptomatic. So I encourage women to not jump into surgery for labral tears right after giving birth, like within the first 6 months, to see if your soft tissues can not be so stretchy, for lack of a better medical term there, and that a lot of times their symptoms get better with physical therapy. And sometimes pelvic floor therapy can be helpful for labral pain symptoms too.
Thank you very much, Dr. Grossman. That is all the questions that we have right now. Dr. Grossman, would you like to close?
Thank you all for joining me today. It's been a pleasure speaking to you. If you have any questions or concerns, please don't hesitate to reach out. Once again, I'm at the Tyson's office and the Fairfax office, and I'm happy to talk to you about any of your hip problems at any point.